Welcome to the next session of Dr. Plotzker's Mind. Today I think I'm going to talk about something medical, something that I am professionally familiar with and proficient at, or at least once was proficient at. My medicines need to be revived or reconsidered. For 40 years, I spent every day, multiple times every day, trying to get people on the combination of medicine that would be most beneficial to them, since the majority of the people I treated had diabetes. They got anywhere from 1 to 3 agents to lower their blood sugar. One of a small group for lowering the blood pressure and protecting the kidneys, and a statin to minimize progression of atherosclerosis leading to heart attack or stroke. Now, within this context, people really did have adverse effects of these medicines. Mostly I recognized what they were, with a few exceptions. There were alternatives pretty readily available, though until roughly the time of my retirement or shortly before, not very good alternatives to the statins. I need to take a few medicines too. My blood pressure has been high. Evidence is overwhelming that bringing the blood pressure down enhances longevity and minimizes disability. My father's cholesterol was astronomically high. My untreated cholesterol is also clearly high. He developed symptomatic angina when he was younger than my current age and had coronary revascularization, not that far an age from where I am now. So I think taking the statin is pretty important. I've had multiple attempts to discontinue a proton pump inhibitor and will be getting an upper endoscopy, my second one, within the next few months. But enough therapeutic trials off of it indicates that I am not going to be off of it for very long. The statin is gone. It's been gone. No, I'm sorry, not the statin. The SSRI is gone. I could tell what's different with and without it. For the most part, I feel better without it. So that left me kind of achy and cranky on what I was on. So rather than burden my doctor, who's also been making suggestions on my medicine, I did pretty much what I would have done for a patient, and that is get rid of everything that does not have an immediate need. The proton pump inhibitor has an immediate need, and the ACE inhibitor has an immediate need, and I've been on it without feeling um, as achy and bludgeoned as I do now while on it. So it's unlikely that either of those are contributing to um, some of the unpleasant symptoms that I've been having. So hydrochlorothiazide went, proton pump inhibitor moved from the evening to the morning uh, in compliance with the recommendation of the New England Journal on uh, gastro and esophageal reflux. Statin is on hold, and hydrochlorothiazide and amlodipine on hold. I did pretty well for a few days. My first blood pressure was pretty decent. And after about 5 days on the reduced medication, I feel considerably better, suggesting that we don't have to go looking for rheumatologic diseases or oddball infections. It was the medicines that were dragging me, but I don't know which one. My blood pressure came back up. I had been on amlodipine and lisinopril together, which did not um, restore my blood pressure to the therapeutic targets. So hydrochlorothiazide was then added with an early misadventure, a hiatus, and about 3 months ago reestablished. As my systolic blood pressure approached 150, I opted to restart that. That leaves me about another week to assess symptoms, which are clearly better, and to follow my blood pressure on 2 agents alone. It is still possible that amlodipine, which causes all sorts of vague symptoms, and statins, which are mostly musculoskeletal symptoms, can still be implicated. But for now, I simply need to track the blood pressure. It helps to be methodical. When I take control of myself, I have that luxury because I can follow the blood pressure. I can get a pretty accurate sense of how I felt before and how I felt after. These are things I could not do as the steward of the patient's needs, but I can do it for myself. So far, so good. I still need to monitor the blood pressure. And at some point, I am going to need to reintroduce the statin, but I don't want to do that until I am feeling particularly well for a short time longer. So that's how I approach my own medicine side effects. We'll see how it goes. Thank you very much for sharing some time with Dr. Plotzker's Mind. I look forward to having you back at the next session.